Lorazepam by Morgan McAllister. The generic name is Lorazepam. The brand name is Ativan. The chemical name, a little bit of a tongue twister, chlorohydroxy dihydrobenzodiazepine. Say that 10 times fast. The slang names are Roofies and Heavenly Blues. And the formula is C15H10Cl2N2O2. Classification. Lorazepam is in the class of medications known as the benzodiazepines. Use of drug. It is used to treat anxiety and sleeping problems that are related to anxiety. It can be taken to help you relax before an operation or other medical or dental treatment. This is known as a pre-med. It can also be given as an injection in the hospital if you're having a seizure or fit. Mechanism of action. Lorazepam binds to benzodiazepine receptors on the postsynaptic GABA-A ligand-gated chloride channel neuron at several sites within the central nervous system. It enhances the inhibitory effects of GABA, which increases the conductance of chloride ions into the cell. Auxiliary label. Keep Ativan and all medicines out of the reach of children. Do not take if you know you are pregnant. Avoid drinking grapefruit juice while on this medication. That is very important. There's a few medications that have that auxiliary label, which is pretty surprising since grapefruit juice is just a regular juice. Like, it's not alcohol or caffeine or anything, but it's really interesting. I found that really interesting. Special precautions. This medicine may be habit forming. If you feel that the medicine is not working as well, do not use more than your prescribed dose. Call your doctor for instructions. Do not stop taking it without checking with your doctor first. Your doctor may want you to gradually reduce the amount you are using before stopping it completely. This may help prevent a worsening of your condition and reduce the possibility of withdrawal symptoms, such as convulsions, hallucinations, headache, stomach or muscle cramps, tremors, trouble sleeping, or unusual behavior. Drug interactions. Using lorazepam together with diphenhydramine may increase side effects such as dizziness, drowsiness, confusion, and difficulty concentrating. Some people, especially the elderly, may also experience impairment in thinking, judgment, and motor coordination. Contraindications. Lorazepam is contraindicated in patients with hypersensitivity to benzodiazepines or to any components of the formulation, in acute narrow-angle glaucoma, pre-existing CNS depression, coma, acute pulmonary insufficiency or sleep apnea. Encephalopathy may be precipitated in patients with severe hepatic insufficiency. Side effects: drowsiness, dizziness, loss of coordination, headache, nausea, blurred vision, change in sexual interest/ability, constipation, heartburn, or change in appetite may occur. If any of these effects persist or worsen, tell your doctor or pharmacist as soon as possible. Dependence. Ativan is a potent benzodiazepine that has a high potential for abuse and addiction. Taking Ativan for any period of time can lead to physical and psychological dependence based on several factors, including genetics and personal history. People with a history of drug and/or alcohol abuse or untreated mental health disorders are at a greater risk for developing an Ativan addiction. Onset of action. The onset of its action is 1 to 3 minutes if administered IV and 15 to 30 minutes if administered IM, which is intramuscular. And lorazepam reaches its peak plasma time in 2 hours if administered orally, which is the most popular. Half-life. The average half-life of unconjugated lorazepam in human plasma is about 12 hours, and for its major metabolite, lorazepam glucuronide, is about 18 hours. Excretion. About 90% of administered lorazepam is excreted in the urine, largely as the glucuronide, and urinary excretion is virtually complete in 4 days. Small amounts of other metabolites in the urine and possibly some free lorazepam in the feces were also detected. Administration routes. Lorazepam can be administered orally, intravenously, or intramuscularly. The intravenous route is to be preferred over the intramuscular route. Care should be taken to avoid injection into small veins and intra-arterial injection. Available strengths. 0.5 milligrams, 1 milligram, and 2 milligram tablets are available. The usual range is 2 to 6 milligrams per day, given in divided doses, the largest dose being taken before bedtime, but the daily dosage may vary from 1 to 10 milligrams a day. For anxiety, most patients require an initial dose of 2 to 3 milligrams per day, given BID or TID, which means twice a day or 3 times a day. Thank you. I'm glad I can be of some service to people who may not know too much about this medication. I really appreciate you taking the time to sit in on my presentation. Have a great day.